Good day, happy Hempers, trust you're safe and healthy. Welcome once again to the Vibe with Hemp channel here on YouTube. And I'm gonna continue my story with you guys with regards to why did I leave the pharmaceutical industry and why did I leave the surgical industry. And to be quite honest with you, I was extremely happy doing pharmaceuticals. I loved it. I loved giving my piece of knowledge and sharing that with a doctor. Prescribe this, those are the dosages, that's it, that's the age group. Don't give it to this kind of patient, give it to that kind of patient. I loved what I was doing. The only thing that actually upset me about the pharmaceutical industry is that I couldn't talk about any side effects. Now, when you become or you train as a medical or pharmaceutical rep, you go through immense, extreme training. And in that period, you write tests, you have to get a 95% pass rate, otherwise you are not accepted. You get 3 chances to get 95%. So they are extremely strict, all credit to them, beautiful. I loved what I was doing. The only side effect, the only negative thing about the pharmaceutical industry is that I couldn't talk about any side effects or bad things that the drug or medication can possibly do. So I was only told to tell the good things. Now, when I did a certain product or marketed a certain product, there were like 2 positive sides to this little molecule versus 27, give or take, side effects. In other words, that actually put me off of pharmaceuticals. I wasn't happy to do that because I'm an ethical, honest person. And I loved what I was doing, but I didn't like that in terms of speaking only the good about a product, but we actually know what all the side effects of this molecule contains. That's why I left pharmaceuticals. And I will be doing talks around South Africa quite soon now, where I explain all the specific molecules that I have done, HRTs, hormone replacement therapy products, blood pressure medication, antidepressants. I have done or marketed all the products out there currently on the market. Well, majority of them, NSAIDs, non-steroidal anti-inflammatory drugs. I've done that. I've been there. I've seen it. I've also seen the side effects it caused to the patients, but I wasn't allowed to say anything. I was working for a multinational pharmaceutical company, so you keep quiet, you do your job, you earn your money, and that's it. After that, I decided to go into surgery. Maybe that would be more ethical for me, more a hands-on approach in terms of doing surgery, assisting specialists in theatre with regards to brain surgery, gynecological surgery, cardiothoracic surgery, plastic surgery, orthopedic surgery, everything. I did it. I was there. I was in the theatre. I assist them. I told them how to insert a certain product because I was the product specialist. I knew the anatomy, so did they, but only I knew how the product must be inserted into the patient. And what happened one day, and that's the problem, that's the reason why I actually started my own company. One day I stepped into theatre, and we were about to do a vascular surgery procedure. We were about to insert a perm cath. A perm cath is a catheter, permanent catheter, inserted into patients that are undergoing renal dialysis. So they need a catheter that gets connected onto the machine to get them, that helps to rinse them, get the blood clean, etc. So I was about to step into theatre to insert a perm cath under the guidance of a vascular surgeon, And a sister approached me from the renal unit. She was head of the renal unit. And she told me, Lelani, my mum needs a perm cath immediately. She is end-stage renal failure. Can you kindly please send me a quote? And remember, at that stage, I did not work for myself. I was working for a multinational surgical company. So I said, okay, sister, I will give you a invoice. Let me just go and do this procedure. I'll get back to you. Thank you. We did the procedure. I went back to my office, to the company I was working for. I had to quote her on a perm cath, a permanent catheter, and I also knew the price that they actually imported it from America. It was 350 Rand, 350, 350 Rand to get the whole product here, done. Import costs, everything included. I quoted her, I had to quote her 6,600 Rand for a perm cath to be inserted into her mum. End-stage renal failure. People, I gave her the invoice or the quotes. She said, oh, I can't afford it. Needless to say, long story short, her mum passed away because she couldn't afford the perm cath, the catheter. That's why I started Viper Med. I was sick of not discussing or sharing any side effects. I was sick of products that could help people, that could save a life, but they can't afford it. That's why I started Viper Med in South Africa, and I'm proud to say my company is all about saving lives, making lives more lively, making the one chance we've got in life to live, making that more feasible to every and each person out there. People, that's why I started Viper Med. Low cost, high quality, best products, guaranteed. We've got all our certificates of analysis. I've stepped away from pharmaceuticals and from surgery. And we specialize currently in CBD and hemp products, as well as my skincare range called the Terra, which is absolutely just hemp as a base oil. Hemp and CBD is the future of healthcare. Low cost, high quality, best products. Kindly please subscribe to the Viper Med Hemp channel here on YouTube. But people, that's why I left pharmaceuticals and that's why I left surgery. Kindly please visit my website as well. You will read all about me on my website as well as on Facebook. My website address is www.viper3med.com. Go look at my website. Observe it. Also, kindly please visit my Facebook page, Lelani Badenhorst. You will see the hemp and the CBD logo there. It's available at Pick n Pay pharmacies nationwide here in South Africa. And please subscribe to the Viper Med Hemp channel here on YouTube. Love you. Be safe. Be good. Be healthy. Be hemping. Catch you later. Thank you.